We've all had a stomach ache, but what happens when that everyday complaint turns into a full-blown chronic mystery? Well, today, we're going to put on our detective hats. We're going to follow the clues, piece together the evidence, and really uncover the story behind a super complex condition that affects millions of people: Crohn's disease.
It's a question we've probably all asked ourselves at some point, right? A bad meal, maybe a little stress, a stomach bug. Usually, they come and go. But what if it doesn't go away? What happens when it becomes this persistent, nagging problem? Well, that's exactly where our investigation kicks off.
So every good detective story starts with a solid lead. For us, that initial clue is diarrhea that just won't quit. But to solve this case, we've got to first understand exactly what we're looking at. Because, not all clues are created equal.
Okay, so on one hand, you've got acute diarrhea. This is the short-term stuff, usually caused by some kind of infection, and it's gone within a couple of weeks. But what we're focused on is the other side of this coin: chronic diarrhea. When symptoms hang around for 4 weeks or more, that's a huge signal that something way more complex is going on under the surface. It's not just a bug anymore, it's a lead.
With chronic diarrhea as our main clue, it's time to line up the usual suspects. And let me tell you, the list is long. It could be a lingering infection, maybe an immune thing like celiac disease, a food allergy, or even lactose intolerance. And then there's this whole category of conditions called inflammatory bowel disease, or IBD for short. This huge range of possibilities is exactly what makes the initial investigation so tricky.
So after we rule out all those other possibilities, our investigation starts to narrow down. We're zeroing in on one key suspect from that lineup: a very specific type of inflammatory bowel disease. And here it is, Crohn's disease. So what is it? Well, it's a chronic condition where the body's own immune system kind of gets its signals crossed and mistakenly attacks the digestive tract. This causes inflammation that just sticks around. This is the culprit we've been hunting for. But to be absolutely sure, we need more specific clues.
The first batch of clues pops up right where you'd expect them, in the gut. These are the classic signs for sure. That inflammation leads to things like abdominal pain and diarrhea. And because the body's not absorbing nutrients properly, it can cause some pretty significant weight loss. Internally, painful ulcers can even form all along the digestive tract. Now, here's where the plot really thickens. And this is what's often so confusing for patients. The clues aren't just stuck in the digestive system. Crohn's is what we call a systemic disease. That means the inflammation can show up in your joints, almost like arthritis. It can show up in the eyes or even on the skin. These extra intestinal clues are absolutely critical. They tell us we're dealing with something that affects the entire body.
Okay, so we've got a strong suspect and a growing list of clues. Now it's time to move from just suspicion to actual confirmation. Medical detectives need hard evidence, right? So this next phase is all about gathering that proof.
The whole diagnostic process is really methodical. It kicks off with what's called history-taking, where a doctor just listens and analyzes all those symptoms, both inside and outside the gut. Then come the lab tests. This is where they check the blood for markers like ESR and CRP, which are basically proteins that act like little red flags for inflammation somewhere in the body. But the final, definitive evidence, that comes from a biopsy, where a tiny tissue sample is taken right from the inflamed area to be analyzed. And under the microscope, bam, there's the smoking gun. Doctors find 3 key signs. First, skip lesions, which are these weird patches of inflamed tissue sitting right next to perfectly healthy tissue. Second, transmural affection, which is a fancy way of saying the inflammation goes through the entire bowel wall, not just the surface. And finally, a cobblestone appearance, which comes from deep ulcers that create this bumpy texture. This is the undeniable proof.
So once the culprit is identified, the focus totally shifts from investigation to action. See, since Crohn's is a chronic condition, there isn't a simple cure. Instead, the goal is to create a really solid long-term management plan.
And the treatment strategy, it's really a 2-part approach. First, you've got induction of remission. Think of this as the emergency response, using powerful treatments to shut down a flare-up and get the inflammation under control. Then, once things have calmed down, the goal switches to maintenance of remission, which is all about keeping the disease dormant and preventing it from roaring back to life.
To induce that remission, to put out the fire, doctors have a few really powerful tools in their toolkit. An elemental diet, for example, can give the bowel a much-needed rest. But the real heavy hitters are corticosteroids. These are potent anti-inflammatory drugs that quickly reduce swelling and calm down that overactive immune response. Budesonide is just a specific type of steroid that's often used because it targets the gut a bit more directly.
Now, for the long game, maintaining that remission, the medications are different. Doctors use immunomodulators, drugs like azathioprine, that work by kind of dialing down the immune system so it's not so overactive. And then you have these really advanced biologic drugs, known as anti-TNF agents, which are super-targeted therapies that block a specific protein responsible for causing all that inflammation.
So a diagnosis has been made and a management plan is officially in place. But the story doesn't just end with a prescription. What does it actually mean to live with a chronic condition like Crohn's, day in and day out?
This is such an important question, because long-term with Crohn's means being vigilant. It's basically a lifelong partnership with your medical team to constantly monitor for potential complications that can pop up, either from the disease itself or sometimes even from its treatment.
And that vigilance means watching for a whole range of potential issues. For instance, anemia can develop simply because of poor nutrient absorption. Jaundice might show up, signaling gallstones, or maybe as a side effect to medication. And even when the Crohn's itself is quiet, new abdominal pain could actually point to other problems, like pancreatitis or kidney stones. It's this constant process of partnership between the patient and their doctor.
And that brings us to our final thought. You know, in a detective story, we always look for that clean resolution, that final case closed moment. But with chronic illness, the definition of success completely changes. The victory isn't about finding a cure that makes the problem vanish forever. The victory is in the relentless, day-to-day work of management, of understanding the disease, controlling the symptoms, and empowering a person to live a full and active life despite it all. That control, that resilience, that is the real triumph.